Mr. Wallace is an elderly man with a hearing impairment. He is currently in the post-surgical unit of a community hospital recovering from his recent hip surgery.
Okay. Mr. Wallace, post-operative of a hip surgery. Typical old people. I got this. What's up? Just get this wrapped in
What are you doing?
real quick.
What are you doing?
He's doing your vital signs, sir.
He's hard of hearing.
I'm just doing your vital signs, sir. You need to calm down.
I can't. What was that? I can't hear you.
Forgot my watch.
Huh?
One
You said-
Mississippi, two Mississippi.
What's going on?
You know what? I can't take this anymore. I'm leaving. Look, I don't have time for this, so I'm getting someone else.
What she just say? She said something? What she just say?
In the pre-interaction phase, review the available data, including the medical and nursing history, anticipate health concerns regarding the patient, provide privacy during the interaction, and take enough time to gain useful information from the patient.
Here. Good luck.
Okay, 80-year-old male named Mr. Wallace, hard of hearing, post-op, day 2 hip surgery. Okay.
During the orientation phase, setting the tone for the relationship by adopting a warm, empathetic, caring manner is crucial. It will help assure the patient and create a more comforting atmosphere. The nurse begins to make inferences and form judgments about patient messages, health status, and behaviors as they are interacting. Prioritize the patient's problems and identify his or her goals. Also, specify the roles of the patient and nurse. Then let the patient know when to expect the relationship to be terminated.
Hello, Mr. Wallace. My name is Ashley. Hi, Mrs. Wallace. My name is Ashley. I'm going to be your nurse for the next 6 hours. I know you have a hearing aid. Can you hear me okay?
I can hear you just fine.
Okay, how's your day going?
That was going okay until that crazy nurse done grabbed me all kinds of uncomfortable ways, making me in pain. That's what it was.
Oh, okay. Well, I'm sorry about that. That must be frustrating, but we'll make sure that from now on, you know everything I'm going to do before I assess you, and I'll make sure that I don't cause you any pain. Today, our goal is actually to assess if you have any pain and to treat any pain you might have. So, on a scale of 1 to 10, the 10 being the most pain, do you have any pain, or how would you rate that?
I would say my pain is more of an 8.
An 8 out of 10?
Yes.
Okay. Well, I'm going to get you some pain medication, and then I'll be right back. Okay, be right back. Okay, Mr. Wallace, if you can put your hand out for me. Here are your pain medications. Here's your water. I'm going to take that. I'll take that. Okay, I will check up on you about an hour from now to assess your pain level again, make sure that the pain medication is helping. Right now, I'm going to check your blood pressure and assess your incision site to make sure that there's no swelling. So, first I will check your blood pressure. And just lift your arm. You can just place your arm in there for me. Okay. Your blood pressure is 120/80, so that is good. Now I'm just going to look at your incision site. You don't need to move, I'm just going to look. Okay. There's no inflammation, I don't see any bleeding. So everything looks good for now. Is there anything else I can get you?
No.
Okay, I'll be back in about an hour to assess your pain level, okay? If you need anything, here is the call light. Just press this button and I'll come right away. Okay? Hello, Mr. Wallace. I actually was just coming back to check on you and to assess your pain level again out of that 1 to 10 scale. What would you rate your pain?
I would say it's going to be more of a 4.
Is that a 4 out of 10 right now?
I feel great.
Great, that's awesome. We wanted it below a 5 out of 10, so that's awesome. I'm just going to let you rest again for another hour and I'll come check on you. Again, if you need anything, just press the call light, okay?
Okay.
Okay.
The working phase is when the nurse and the patient work together to solve problems and accomplish goals. In our scenario, Nurse Ashley is encouraging Mr. Wallace to express his feelings about his pain that he is feeling. Nurse Ashley also used therapeutic communication skills to facilitate successful action by explaining to Mr. Wallace the exact steps she was taking when she was assessing him. Nurse Ashley was effective in her communication because Mr. Wallace was able to understand her and showed that he was much calmer with Nurse Ashley than with Nurse Heather. Nurse Ashley encouraged Mr. Wallace to take action by cooperating with her when she was taking his blood pressure and assessing for inflammation or redness at the incision site. Nurse Ashley asked Mr. Wallace if he had any pain, and he explained he had a high pain level of 8. And they set a goal that by the time Nurse Ashley leaves for the day, they work together to reduce his pain level to 5.
The termination phase. The termination phase is during the ending of the relationship. The nurse will explain to Mr. and Mrs. Wallace that her shift will be over soon. She will separate from Mr. Wallace by relinquishing responsibility for his care. She will arrange for Mr. Wallace to see a physical therapist closer to his discharge date to help him regain strength and to get back to his regular activities of daily living. She will also review with Mr. and Mrs. Wallace what was done in the time she was with them.
Okay, Mr. Wallace and Mrs. Wallace, I just wanted to go over some things with you. My shift is about to end, but I just wanted to let you know we're going to set you up for some physical therapy before your discharge tomorrow. The name of the doctor is going to be Dr. Swanson. He's going to help you regain strength and just recover from your surgery so you can return to your daily activities of living. The clinic that he has is close to your home, and he also works out of this hospital. So I just wanted to give you this. I'll leave that to you to hold on to. The oncoming nurse will give you more details right before your discharge, but I just wanted to explain to you that you will be receiving physical therapy before you're actually discharged. Do you have any questions for me?
I don't think so. Not right now.
Okay. Well, it was nice meeting both of you.
Thank you.
Mm-hmm. Good luck with everything. Good luck with your recovery. Your next nurse will be in shortly to check on him, okay?
Okay.
All right. Have a good night.
The verbal communication techniques used by Nurse Ashley include pacing and vocabulary. Her speech was slow and she enunciated clearly. She also used appropriate word choice during her interaction with Mr. Wallace. The nonverbal communication techniques used by Nurse Ashley include eye contact, hand gestures, and a clean personal appearance. The verbal communication techniques used by Nurse Heather include intonation and clarity. Her tone of voice expressed anger and carelessness, which inhibits further communication. Nurse Heather also did not speak slowly or enunciate clearly. The nonverbal communication techniques used by Nurse Heather include an unpleasant facial expression and sounds such as sighs and moans to express her frustration with Mr. Wallace.
Relationships can move in a positive or negative direction. Nursing actions can be bridges or barriers to a good nurse-client interaction. The bridges seen in this scenario were empathy and trust. Empathy is the ability to understand and accept another person's reality, accurately perceiving feelings, and communicating this understanding to the other. Good Nurse Ashley expresses empathy by reflecting that she understands and feels the importance of Mr. Wallace's communication. Ashley used empathetic statements that were neutral and non-judgmental, helping to establish trust during the nurse-client interaction. Trust is also critical to successful interpersonal relationships. A strong foundation of trust promotes comfort, security, and honesty. Nurse Ashley portrays trust by introducing herself and describing her role. She gained trust by providing consistent, respectful, patient-focused care. A couple of the many barriers seen in bad Nurse Heather's scenario include a lack of caring and a lack of mutuality. Caring is a universal phenomenon influencing the ways in which people think, feel, and behave in relation to one another. Bad Nurse Heather displays a lack of caring by showing a lack of interest and understanding for Mr. Wallace. She puts meeting her own needs and time constraints before meeting Mr. Wallace's. Heather displays a lack of mutuality by showing an obvious lack of patient involvement. She did not involve Mr. Wallace and his wife in agreeing on his health problems and the means for resolving them. Both parties were not equally committed to enhancing the client's well-being.
Caring is defined by Kristen Swanson as the nurturing way of relating to a valued other toward whom one feels a personal sense of commitment and responsibility. This includes the elements of maintaining a belief, knowing, being with, doing for, and enabling. The good nurse Ashley demonstrates these by keeping a hope-filled attitude towards Mr. Wallace, though he has impaired hearing. She assures his understanding by keeping him informed of what she is doing at all times, which helps comfort him and his wife. The bad nurse, Heather, is unable to care for him in the way he deserves. She ignores Mr. Wallace's questions and does not take the time to understand him. Caring is central to the nursing practice, and it is the nurse's responsibility to ensure positive care to every individual, regardless of the situation.